Hi, and welcome to the OT is In, the podcast where we merge the worlds of education and occupational therapy to empower families like yours. I'm Sarah Collins, your host, an occupational therapist and a homeschooling parent. I've experienced occupational therapy by supporting families for over 15 years, but also through seeking out support of my own children, so I'm right here in the trenches with you. Though there is not one way to educate your child, there is a lot to consider when individualizing an education. And the goal of this podcast is to explain some of the why behind what an occupational therapist is thinking so you can apply it to your own family. Especially with my three favorite topics: executive functioning, handwriting, and sensory processing. Each episode will be packed with practical tips, expert interviews, and real-life stories aimed at helping you to create a supportive learning environment for your child. So, grab your headphones and get ready to dive in of the collision of education and occupational therapy. I'm Sarah Collins from Homeschool OT, and I'm thrilled to have you with me on this journey of discovery. Hey, and welcome to this episode of the OT is In podcast, where I, your host, Sarah Collins, am joined by Dr. Jody Jedlicka, an experienced audiologist, to demystify auditory processing disorder, also known as APD. If you've ever wondered what APD is, how it affects children, or what steps you can take to help your child thrive, this episode is for you. Or if you're just noticing something is a struggle with reading or speech, this episode is also for you. Dr. Jedlicka draws from her background working in educational and clinical settings to explain how auditory processing disorder is more than just a hearing issue. It's a neurological challenge that impacts how the brain interprets sounds. Together, we explore the signs and symptoms of APD. We delve into its close connections with reading, speech, and other sensory systems, and break down the process of getting a diagnosis. Most importantly, we highlight the hope and the progress possible through effective treatments like auditory training and phonics-based reading support. So with practical advice for parents, insight into how speech-language pathologists and audiologists work together, and recommendations for finding resources, even when specialists are hard to come by. This episode is packed with valuable guidance. So whether you're a parent, an educator, or simply curious about how the brain processes sound, tune in for an engaging, informative conversation that sheds a light on a topic shrouded in confusion. Hey, my name is Sarah Collins, and I am here today with Jody Jedlicka, who is an audiologist. And you guys, I hear questions all the time. People confused about what on earth auditory processing disorder is. Questions of, does this actually affect my child? Is this reading? And so I wanted to make sure that I could find an audiologist to come here and explain it all to us. And here we are. We have Dr. Jody Jedlicka. So first of all, before we even get started and dive in on that, can you tell us a little bit about who you are and how you came to this point in your career?
Oh, I would love to, without dragging it on, because I'm kind of old. So I started my career as an educational audiologist, actually. So I was an educational audiologist for the Milwaukee Public Schools, which is a big job for a small town girl coming to the big city. And we had responsibility in that job for hearing screenings and maintaining and taking care of the classroom needs of kids with hearing impairments in the school district. And it's a huge school district. And just as part of that position, that was my first job right out of college. So this was me, a fresh new baby audiologist, coming into a situation like that. And it was just started to just really, I don't know, dawn on me or fester within me, like the impact that hearing has on learning and reading, and just how many kids were affected, not only with just a hearing loss, but with other hearing related challenges that really impacted their education. And that was really fascinating to me. My next position was as a clinical supervisor at University of Wisconsin-Oshkosh. And so there I was leading college grad students in the clinic, and we did auditory processing testing, diagnosis, and treatment. And so that's where I really got to dive in deep. I always thought it was really cool that I could diagnose that issue for parents. So they would come to me from all over the state because there's not a lot of us who specialize in this. And so they'd come to me, and it was really fun to be able to say, yes, you're right, there is a problem, and just justify their concerns and validate their concerns. But I was really looking for what can I do to help them? Because it's one thing to be validated, but then it's like, what's next? What
do I do?
And that's where I got involved with Learning RX and treating those disorders. And so that's in a nutshell how I got to where I am today.
Amazing. And quite a journey. I love how you've noticed something, how there's a struggle, right? And then you just kept going with it until you were like, how can I support families? That is such a beautiful journey. Okay, so then let's share, or can you share a little bit about what exactly is auditory processing disorder? I know you've done this deep dive. We have a short amount of time here, but what exactly is it?
Yeah, so an auditory processing disorder is actually a neurological condition that affects how your brain interprets sound, especially speech sounds. And people who have auditory processing disorder have normal peripheral hearing, meaning they can sit in a booth and raise their hand at the appropriate time when, they hear a beep. But the way that they would pass a hearing test, but the way they behave with sound is almost like they have a hearing loss. Their brain just doesn't interpret it well or clearly. And there's lots of different kind of nuances to that, because if you really break down or get into the details of what you all have to do to hear a message and interpret it and attach meaning to it and respond to it and things like that, there's just so much that's involved. But I would say the big things would be just being able to hear speech clearly. So can I hear the speech sounds? Can I interpret what's being said to me? And I would say, to give you a kind of a real life example of what that might feel like for somebody with an auditory processing disorder, I fly a lot. So when they do those announcements in the airport, your gate is changing or we're waiting for the person. Boy, oh boy, if there's anyone sitting around me or there's any background noise or anything like that, darn if I can tell what they said and what gate.
That's so true.
So I always imagine that's what a student or a child with an auditory processing disorder must feel like. What the heck did they just say? And how am I going to figure it out? So I feel like there's a lot of anxiety that can go along with that.
Yeah. Yeah. Does it tend to be whole words and whole sentences, or just specific sounds?
Usually it is specific sounds that give people problems, but it's hard to really dig into what those sounds are until you just really take a deep dive into it. Okay. And so we call it, in audiology, we call it auditory closure, meaning that if you don't hear the whole sound, can you fill in the missing pieces of that word to make it mean the right thing? And if you think of how easy it is to mishear or misunderstand someone, I think it has a much bigger impact than what people think. And so if you only hear part of a message and you're relying on your experience or your understanding of language to fill in the missing pieces, that's actually a harder thing to do, especially if you're a student hearing new vocabulary or being presented with new concepts or being asked to read when, gosh, I'm not even sure if I know what that sound's supposed to sound like.
Yeah.
And reading is so much more of an auditory skill than people recognize it to be. It's much more auditory than it is visual, actually. If you think about it, you can give a blind person Braille and they can actually learn to read just like anybody else can if they have good auditory processing. But if you flip that around and you try to teach someone with a hearing loss or an auditory processing disorder, they have a much harder time understanding the sounds, understanding how they fit together. They have to be able to hear them in the right order, hear them accurately in order to become a good, strong, fast, fluent reader.
That's fascinating. So is there a connection between auditory processing and speech?
There is a connection between processing and speech. And actually, that's kind of one of the background theories of where does this all come from. And I think there is no one place that it comes from. It can be genetic, it can be auditory deprivation. Say you've got a child who's just had ear infections their whole childhood up. Some kids are just prone to that, and they just don't have the exposure to speech that kids who don't have that issue had. And so they're able to, they struggle with development.
Yeah.
Sometimes kids will grow out of it down the road. Sometimes you can hear it in their speech because if you don't hear it correctly, you don't say it correctly.
Yeah, so can I stop there for 1 second to dig in? Because that is where a lot of families come to me, especially for kids who have struggle with their R's, right? The R controlled syllables. And then they really struggle with reading and spelling with the difference in ER, IR, AR, which is so hard anyway. But that is one of the questions. So would those two, would they likely be related?
I would think yes, they would be
Okay.
related. I'm not sure I can say that definitively for every child, but I can say that if a child has difficulty, say, hearing their R, and it is caused by an auditory processing difficulty, the therapy or the treatment for that might be the same regardless of which issue it is.
Okay, whether it's speech
We
first
want
or okay.
Yeah, yeah. So it's not necessarily, I don't know how to say this and not say it definitively, but you don't necessarily have to pull them apart in order to be able to treat them. Oh, and you have difficulty with those R's, but you see a speech pathologist to help you create that sound better. They at the same time are going to be exposing them to that sound. And auditory processing disorder is very treatable. And I think that's the exciting news about it.
Yes, so let's dive into that a little bit more. So being very treatable, except that people can't find any resources to treat it, right? But first, let's go back to how do you go about getting it diagnosed and then treated?
Yeah. I would say that it is sometimes a challenge to get it diagnosed because there's not many audiologists who specialize in the diagnosis and treatment of auditory processing disorders. And I would say too, it's not something that we may take a class or two on it in college, but if somebody's really interested in it, they really need to dig into it themselves a lot of the time. I won't say all the time, but you cannot just call a clinic and say, hey, I want to schedule an auditory process
Right.
evaluation because we're just few and far between. But if you do call your local audiology clinic, and I would say it's really important to have an audiologist do the testing. If you do call that clinic, they probably can guide you to the nearest audiologist who does that type of testing because we all know because they are few and far between.
Yeah.
We kind of have to have those referrals in our back pocket. So that's where I would start, but you really do want someone who specializes in that and what to do once they make that diagnosis and what kind of treatment can they help steer you to. And that's what I was alluding to before. It's really nice to be able to say yes or no, there's an issue or we're not the right answer for you. But even more important to be able to give them what's next, what comes next for us and what comes next for our child. How do we fix this? How do we move towards something easier for them?
Absolutely. So once you do go through a diagnosis, and so you did mention before that sometimes speech and audiology, or with your learning speech sounds and auditory processing, can coincide. So if there isn't an audiologist nearby, do speech therapists work on some of these same issues?
I think a speech therapist is probably a really good place to start if there's
Okay.
not an audiologist nearby. I would say speech and audiology are very connected. And so, yes, if you cannot find an audiologist for that, you could go to a speech therapist. When you struggle with auditory processing, some of the resulting issues that happen because you have that challenge, like reading problems or difficulty being able to hear in background noise or trouble following directions, or some of the like outcomes or the resulting problems that happen with that are things that that a speech pathologist can address. I would say that's the other challenge too, is that most audiologists don't do auditory training. And so they probably are going to send you to a speech pathologist for that anyway. So I think that's a good place to go next. I know that my affiliation with Learning RX, but Learning RX auditory training focus is just phenomenal. And so if you have someplace, a resource like that does cognitive training or auditory training, those would be other really good places to go to. And I would say if you can describe the problem and you can be working on it, I think that sometimes is as useful as having the diagnosis. And I hesitate to say that only because I do feel like the diagnosis is important, but you can work on it even if you can't find somebody nearby. I'd hate to have somebody not work on it.
Can't find the person. Right, right. Before we keep going, I want to remind you of the purpose of Homeschool OT. The goal is to support you, the parent, so that you can then help your child be successful in what they need and want to do to occupy their time. This, occupy their time, is the true definition of occupational therapy. Homeschool OT was recently referred to as the search engine for when a child is struggling in their day-to-day life. This actually made me really happy. Now, part of this is because we all know how much time can be spent searching for answers, and some are often conflicting. So instead, we can work one-to-one together to discover the why, prioritize strategies, and implement them into your homeschool. So visit homeschoolot.com/services to see the range of options and get that personalized homeschool support that you need. Now, on with the show. Welcome back. Now, before we go into the treatment side of things, can we talk a little bit more about what a family would see or observe in their child before we would even seek out this diagnosis and treatment?
Yeah, absolutely. Good question. And actually, let me back up just a little bit because we talked about like auditory discrimination as being one type of auditory processing disorder, but it's auditory processing is an umbrella term. And there are other issues depending on where in the auditory system that challenge is happening for a student. So while discrimination is probably the most common diagnosis that we see, kids could also have difficulty like understanding prosody or tone of voice or kind of the nuances of speech that just come because of the way you say things. And then there's also a type of auditory processing disorder where they have to just put it all together. So I call it an integration. That's probably a super common word that you use in your practice.
It is.
Just putting it all together. Are they hearing the sound? Are they knowing the meaning? Are they putting it together? Are they attaching the language to it? Are they able to think about it? So there's a lot going on with that. And so depending on the type, you're going to see different symptoms or different behaviors coming from kids. And so for kids who struggle with that prosody or understanding tone of voice, you're going to see that they may have difficulty understanding the meaning behind what you say. Taking things may be very literal, like if you use sarcasm or humor that sometimes is conveyed by tone of voice, they might miss those things. They might say things a little bit out of order, like temporally they don't get the sounds in the right order. And I use my grandson as an example. One of the words he has always struggled with is tomorrow, and he'll say tomorrow. And
Oh, that's the best.
and it's so cute when he says it, but it was super cute when he was 3. Now he's 9, and so he still says it that way sometimes. By now he should have outgrown that.
Yeah.
Getting there. But kids who struggle with just hearing things clearly, they will have difficulty sometimes following multiple step directions, because if you think about it, it's taking them a second or two to fill in those missing pieces and make sure they know exactly what you said. Think about how hard it is to listen when you're in a group of people. Same kind of thing. You have to take a second and pause. Oh, did I hear that right? And they don't always have all the background knowledge that we have to fill in the missing pieces too. So they may have difficulty following directions. They may have difficulty with new concepts. They're gonna be the ones who struggle with reading. You'll notice that if you look at them in a quiet environment and say something to them, they understand much better than, say, if they're sitting in the back seat of the car and you say something. They can't see your face that way. And there may be other background noise that is competing. Excuse me. They may be very distracted in background noise or have a really hard time in background noise. They may shut down in social situations. So I don't know if you have a parent or a grandparent who has hearing aids. And you'll notice that when the whole family gets together, they kind of sit in the corner and watch.
Yeah, and watch and observe. Yes.
Yeah, yeah. Kids will do the same thing. It's just we don't always know why. And so they may struggle in social situations like that. So those will be some of the things. And then academically, being able to take notes while they're listening, being able to copy off the board. They just have to put a lot of their cognitive resources into things in order to be able to hear and understand. And so sometimes they get overwhelmed
Yeah.
because they just don't have the cognitive resources in reserve to be able to deal with other things. Their bucket is full all the time.
Oh, yes, they're speaking to my OT heart there and how we are, continuously talking about the sensory processing and the overwhelm that comes when you are bombarded, especially when you're putting such a cognitive load on one of your senses. It's so difficult for some of our kids.
Yeah,
Now,
and think about how hard they're working to try and do the right thing, and they just get it wrong all the time. It's like they're trying, so some of those kids just give up, and some of them just are anxious all the time, and some of them, it's a lot. So anyway,
yeah.
my
Oh,
heart.
I hope that helps parents to feel some empathy because I recognize like how frustrating it can be sometimes when you're telling your child to do something for the 30th time, or you've been like, I told you to put your shoes on and come out to the car. And then if we're recognizing how much our kids are working to understand what you're saying, to process that information, and then to react and to do it, it is very difficult.
Agreed.
So, is there a connection? Now, let me back up a little bit. I kind of want to talk about my son for a second and then to see if there are correlations. My kiddo is one that had all of those ear infections over and over again, like what you were saying, he went through 4 different sets of tubes. He also, yeah, also had convergence disorder, visual scanning insufficiency. So he was not really seeing clearly. He wasn't processing that visual information nor the sounds. He took in so much of his world through touch and movement. Do you find a connection between the vestibular system, which, is also inner ear, so very movement related, and how we find ourselves balance wise, like knowing where our body is in relationship to itself? Do you find a connection in auditory processing and that vestibular
Yeah,
system?
interesting question. I think that in my clinical practice, I've never had a parent come to me because of
Mm,
those vestibular issues. However, it is not uncommon for those ear infection kiddos to come in and also have so it doesn't surprise me when they show
mhm.
up in the same kid. But I think it's just a matter of those two systems being so connected.
Okay.
Vestibular is controlled by your auditory system too. And so not necessarily, I don't even know if they correlate. I just think
Okay.
that they often will happen in the same child just because they're in the same part of the body.
Part
So
of the body.
yeah,
Okay. Interesting. All right. So let's now switch over to, because you said earlier how exciting it is that auditory processing disorder is treatable. So talk a little bit more about that. What does that treatment look like?
yeah. So you really do have to have somebody who is versed in auditory training, but a little auditory training goes a long way. And so some kids actually will just outgrow auditory processing challenges. Now, that is happy news, and it's actually a pretty big percentage, although I can't tell you what the percentage, excuse me. But what I worry about even with those kids is how much have they lost before they outgrow it.
Hmm.
And I'm going to still be worried about their reading in the future. And I'm still going to be worried about their ability to take notes and multitask and some of those kinds of things that tend to just go along with it. But the good news is that it's very treatable. And so if you can find a speech pathologist or somebody who does cognitive training like we do, and auditory processing is a cognitive skills can be trained. It's just most audiologists, even the ones that are well versed in auditory processing, don't have the time or the resources to work one-on-one with those kids. That is probably something that they're referring out for. And auditory training is definitely the way to go. You want something that's targeted. You want something that is done one-on-one. You want something with some intensity. You want something you referred to before, or you asked me before about, is it certain sounds or is it everything? And in most kids, what I find is it's certain sounds. And so you want somebody who can identify where are the mistakes that are making, what are the sounds that are giving them trouble, and then who can kind of dig deep into those sounds so that they can really give them a lot of practice hearing those sounds, hearing them in the right order, hearing the co-articulation or how they work together with other sounds on either side of them. And then just getting them comfortable and good at hearing those sounds. But when you train the auditory system, it does well. With kids who have prosodic disorders or difficulty understanding tone of voice, things like that, that might be somebody who has a little more difficulty. It's not quite as adaptable as just being able to hear the sounds and hear them clearly. And then those kids with integration disorders, those I might be referring to my occupational therapist, or if there's other kind of supporting things that are contributing to their practical challenges in everyday life. Like, for example, if attention is a challenge, auditory processing can be contributing to focus and attention difficulties. Auditory processing and working memory challenges.
I was just going to say there's got to be a connection with working memory there too.
Because honestly, if you think about it, those kids need a beat or two to think about what am I filling in as far as filling in those missing pieces. But if they don't have the working memory to support it, by the time they put it all together, it's just gone.
It's gone.
To pull in and think about. And so I really feel like working on looking at all of those cognitive skills together and working on those so that they can work together and support each other, I feel like that is probably the strongest way I've ever come across to be able to deal with it. And then as a parent or as an educator, there are also some things that you can do to help. If you're homeschooling and you're giving a student one direction at a time, you're making sure you're looking at them when they're talking. My grandson, sometimes I'll take his chin and turn it toward me, okay, watch me, and I'll say, no, I said this. And so just being cognizant and empathetic toward what they might be able to do and what they can't do. I try to always assume that they will do it if they want. They will want to do it if we can make it doable for them, if that makes sense.
Yeah.
And so nobody likes to do the things that are hard for them.
Right. Yeah, that's true.
Do what we can to manipulate the situation.
Does phonics training within reading, does that make a difference as well, since you are so focused on those sounds?
Yeah. Phonics training is probably the best way to teach kids who have auditory processing difficulties. But I think use that type of training and work on the auditory processing at the same time, and that's a winning combination for them, at least in my experience.
Yeah. Oh, that's amazing. So what are some really good resources if families need to continue to research this? If they're saying, wait, maybe this is my child, what are some good spots to go look for more information?
So that's a good question too. I would say that if you can find a local audiologist who does that testing, usually they're going to do the testing. So even if they're a little bit of a drive to get to, it's worth your while to really have them dig deep and tease out exactly what the challenges are. And then they can also help you understand what the functional issues that go along with that are, so that you can be modifying your environment to give them the best opportunity for listening and learning. So there's that. And then they should have connections also to local people who can help you with auditory training, speech pathologists, OTs, people like that who are well versed in helping with those challenges. Our company, Learning RX, cognitive training, the auditory training piece of that is just so strong. I've never seen anything quite as strong. We do both one-on-one, and we can do virtual assessments and work with students, and it does not take a really long time to make a pretty impactful change for kids. So
just a piece of practicality, are audiologists typically covered by insurance?
Yes,
Okay.
audiologists are typically covered by insurance. And as far though as the other therapies, treatments, I don't,
Yeah. Varies place to place.
and I'm sure
Okay.
there's insurance
The
companies too.
insurance company. Yeah, of course. There's so many logistics to try to think about of, okay, where can I find somebody and how am I going to be able to fit this into my day and how am I going to be able to afford it? And I know that's so much of what parents are considering. So are there resources? I know you said you do virtual through Learning RX. Are there resources for people who are looking to, I know obviously the best practice would be to find somebody and to be able to build our team, but that isn't always a possibility. So are there home resources that all that you know of?
I think a lot of the professionals that provide that type of training and therapy can help parents to be part of that process.
Okay.
There are definitely online auditory training programs. I always think doing it one-on-one in
Mhm.
person is better and faster and more intense than a computer can be, but in a pinch, that is definitely an option. I think that parents are uniquely qualified to be home helping their kids with this. So if you have
Absolutely.
a professional who will instruct and guide you and help you to be a part of that solution, I think
Mhm.
that's a really good match because then also you've got better carryover when they're doing it at
Yeah.
home and doing it in the therapy session.
Mhm.
So I love the idea of parents being involved in that.
Beautiful. Thank you so much for your time and for your assistance and so much information for this topic that is often asked. Can you tell families how to find you
Sure.
specifically?
Sure. I don't do diagnosis
Okay.
anymore. Now, the last couple of years, I've been at our Learning RX home office headquarters, but they can find me at learningrx.com. They can find me via email at jody@learningrx.com. And I'm always happy to answer questions like this.
Beautiful. Thank you so much again for your time and for your expertise.
That's my pleasure. Thank you.
Thank you for tuning in to the OT is In podcast. We hope you enjoyed today's episode and found it insightful and inspiring. Your support means the world to us. If you enjoyed the show, please subscribe, rate, and leave us a review. And don't forget to follow us on social media at Homeschool OT for updates and behind the scenes content. We'll be back next Thursday with more exciting topics and expert guests. Until then, keep thriving, but remember, there is not one right way to homeschool. Thanks for being here.